moving into the actual mechanics of breathing, it is because of the respiratory muscles. So what are the two processes involved in respiration? Inspiration and expiration. The types of respiration is external and internal, but the two basic processes involved is inspiration and expiration. What are the respiratory muscles involved in inspiration? Anyone? So in the respiratory muscles, we have inspiratory muscles and expiratory muscles. So among the inspiratory muscles, you will see primary muscles of inspiration. So what is this primary muscles of inspiration is? These are the muscles which is basically involved in the inspiration process during normal breathing. Primary muscles in the sense, it will take part its role during normal quiet breathing. Okay, the main primary muscle is diaphragm. What? So the main primary muscle which is involved is the diaphragm, and the secondary muscles, and you will also have external intercostal muscles. Okay, so these are the two primary muscles of inspiration and the secondary muscles of inspiration. Secondary muscles in the sense, it will not do its function during normal quiet breathing. Do we people do the inspiration process now? Are you doing inspiration process? Are you respiring now? Yes? Is it possible for you to sense and you are conscious that you are respiring always? For example, now I am telling you to go and climb the stairs 4 or 5 times, then come and sit inside the classroom. How will be the respiratory process now? After that, you will have increased breathing and you will feel the increased breathing because of the quite difficulty in breathing. So that is the point where the respiratory secondary muscles of the inspiration is taking part its role. Okay, so what are all those secondary muscles of inspiration is scalene muscles, sternocleido, mastoids and scalene muscles. So these are the secondary muscles of inspiration. And now coming to the expiratory muscles. The primary muscles of expiration is internal intercostal muscles. Okay, so the primary muscles of inspiration is internal intercostal muscles, and the secondary muscles of expiration is muscles of abdominal muscles. Okay, in generally, the most important role is given by only the primary muscles of inspiration. Even the primary muscle of expiration will not participate in normal quiet breathing. Why? Because only inspiration is considered as an active process, whereas expiration is considered to be a passive process. Even during normal quiet breathing, the primary muscles of expiration also do not do any work in the respiration. Okay, only during forced breathing. Secondary muscles will take part its role role only during forced breathing. Okay, the secondary muscles do not have any role during normal breathing. When you are doing severe exercises, strenuous exercises in case of athletes, and if you are involved with the forced breathing, only during those periods the secondary muscles will take part its role in performing the respiratory process. But in case of expiratory muscles, even the primary muscle of expiration will not do its role during normal breathing. Why? Because expiration is a passive process. Okay, so whatever muscle has contracted in the inspiration, the diaphragm and the external intercostal muscles, it will contract and it will make the expansion of the lungs, and air enters inside the lungs. After the contraction of diaphragm and external intercostal muscles, they will relax. That will automatically compress the chest wall and expires the air. So that is why expiration is called as a passive process. Even these internal intercostal muscle, even though if it is considered to be the primary muscle of expiration, it will not do a major role in the expiration because it is a passive process. Okay. So that is about the respiratory muscles. So this is the diaphragm and this is the place where you will have your lungs. So the diaphragm is present at the bottom of the lungs. This is the dome-shaped muscles. That is the dome-shaped muscles. You can also represent it like a parachute-shaped appearance. And what will happen to the diaphragm during inspiration is when the diaphragm, this is normal resting state, the diaphragm will be maintaining this dome shape or a parachute-shaped appearance. During inspiration, this is considered to be the primary muscle. So what happens? The diaphragm contracts and it will become flat. So once when it is becoming flat, this volume of space you will get for the lungs to expand, and it is causing vertical dimensional increase in the space for the lungs to expand. Now the inspiration is going to begin. For the inspiration to take place, the lungs should expand. The lungs will expand in vertical dimension. So the shape of the lungs, it will expand vertically. So the lungs will expand in 3 dimensions during the inspiration process. The first one is the vertical dimensional increase that is given by the diaphragm. When the diaphragm contracts, it will become flat. So this dome-shaped structure of the diaphragm will become flat. Then what happens? This volume, this space you will get for the lungs to expand. And this is increasing the vertical dimensional increase of the lungs. Okay. So this is one scenario. So this is how you will get, this is the normal dome-shaped diaphragm during resting period. And so when the diaphragm contracts, it will become flat like this. So this is the space you will get for the vertical dimensional increase. And again during expiration, the diaphragm relax and it will compress the lungs. Air is being expired. Okay. So this is one scenario which is increasing the vertical dimension. And there is another scenario for increasing the anteroposterior dimension of the lungs. That is from the rib cage, anteroposterior dimensional increase. That is given by the external intercostal muscles. So this external intercostal muscles will give 2 kind of movement that you will call as pump handle movement, and the other one is bucket handle movement. First we will see what is meant by pump handle movement. So in this, see the muscles which is covering the outer surface of the ribs, they are called as external intercostal muscles. How the external intercostal muscles is arranged? In this manner, in the downward manner, whereas the internal intercostal muscles are arranged in this pattern. Okay, so when the external intercostal muscle is contracted, it will move the rib cage forward and outward. So when the rib cage is moved forward and outward, then what it will do? It will increase the antero-posterior dimensional increase. Okay, so how many pairs of ribs we have? How many pairs of ribs? 12 pairs. The 11th and 12th pair of rib is considered to be the floating ribs, which is not involved in any kind of muscular movement. They will just float as such, how the other ribs is moving. So the muscles present between the first and the 6th pair of ribs, it will give a movement that is called as pump handle movement. And from the 7th to the 10th pair of rib, it will give the movement which is involved in increasing the antero-posterior dimension, that is bucket handle movement. So this is how the pump handle movement is increasing. See, the ribs is being compared to the hand pump. Have you all seen this pattern of hand pump? Yes, have you used? Yes. So once when you lift the handle of the pump, what is doing? This is the normal position of the handle. And when you lift it upwards, it is moving forward as well as outward. The same scenario from the 2nd to 6th pair of ribs. When the external intercostal muscles between these pair of ribs contracts, it makes the rib cage to be moved forward and outward. Okay. And from 7th to 10th pair of ribs, that is compared to the bucket handle movement. The normal position of the bucket, if you lift the handle of the bucket, it is moving outward. Okay, so this is increasing the lateral dimensional increase of the rib cage. So we are getting 3-dimensional increase. One is vertical dimensional increase, that is by the diaphragm. And second one is antero-posterior dimensional increase. That is because of the movement of external intercostal muscles between the 2nd and the 6th pair of ribs. And the third one is vertical dimensional increase. It is given by the movement of external intercostal muscles between the 7th and the 10th pair of ribs. So altogether, now it has increased the space surrounding the lungs. So during inspiration, the lungs can expand in this 3 dimensions. Okay. And after inspiration, what is the thing which is going to happen? Expiration. For expiration, what is the primary muscle of expiration? Internal intercostal muscles. But it will not do its role. Why? Because whatever muscles has contracted during inspiration, the diaphragm and the external intercostal muscles between the 1st and the 10th pair of ribs, those muscles which are contracted, it will relax. And automatically the vertical dimension decreases, lateral dimension decreases, antero-posterior dimension of the thoracic cavity decreases, resulting in the compression of the lungs. And the expiration process takes place. Okay, but the lungs will not collapse. Why? Because residual volume, intrathoracic pressure, which is maintaining it in the expanded state always. Okay, and what happens during exercise? That is the place where the role of expiratory muscles is involved. Only during exercise, when there is forced breathing, even the primary muscles of expiration will take part its role. The internal intercostal muscles contracts. Whatever movement given by the rib cage, forward movement, outward movement, it will make it backward movement, inward movement to compress the thoracic cage. And it will compress the lungs to expire the forced air which is inspired. And even the secondary muscles of expiration, abdominal muscles. See, you have the diaphragm like this. Normal breathing, the diaphragm is becoming flat. In case of forced breathing, it will go beyond the normal contracted state. Then what is the structure below the diaphragm? The muscles of abdomen. So what will happen during forced breathing when you are doing severe exercises? The muscles of the abdomen contracts and it will kick the diaphragm to go back to its original position and expires the air which is inspired by forced breathing. Okay, so the abdominal contents will kick the diaphragm to go back to its original dome-shaped position. So altogether, inspiration is active process which needs the role of all the muscles to do its work, whereas expiration is a passive process. So that's it. And now we will see a case scenario over here, a bigger case, a 40-minute-old neonate which has given birth at 27 weeks of gestation. So what is the normal gestational period? Yes? 30? 32 to? What is the age of gestation you will consider as normal? What is the normal gestational period? What is the complete gestational period? 40. And from which to which you will consider as normal term birth? 38 to 40. And this is 27 weeks. So in what category you will consider this birth? Preterm birth. Okay. So, and she is noted to have central cyanosis. What is cyanosis? Bluish discoloration of the skin and the mucous membrane. And the respirations are very shallow and rapid breathing. For about 65 per minute, what is the normal respiratory rate? 12 to 15. In case of neonates, it will be around 24, 25. But this is having 65. What do you term it as? Increased breathing of respiration. What is the term given? What is the term you will give? Tachypnea. Okay. And other vital signs are stable. On examination of this neonate, nasal flaring, audible grunting has been observed, duskiness with the intercostal muscles and the subcostal retractions were seen, and fine rails heard over both the lungs on auscultation, and the nasal oxygen is being given, but there is no improvement with the cyanosis. Okay, in the sense the lungs is not responding to the nasal oxygen supplementation. And chest X-ray showed fine reticular granularity, in the sense there is some collapse you are observing, predominantly in the lower lobes of the lungs. And ABG revealed hypoxemia with metabolic acidosis. And what is the underlying cause? ARDS. Can you abbreviate ARDS? Adult Respiratory Distress Syndrome. But this is IRDS, Infant Respiratory Distress Syndrome. What is the cause of this Infant Respiratory Distress Syndrome? So what? Why preterm is causing this condition? Why preterm is experienced this due to surfactant? What? Lung is not matured. So, what is the role of surfactant? Why the surfactant deficiency causing this condition? It reduces friction, no? No. What? Tension. What tension? Alveolar tension. What you term it as? The surfactant reduces the surface tension. What is meant by surface tension? What is surface tension? What is meant by surface tension, ma? It reduces the yes, faster. What is meant by surface tension? It is the tension which is generated between the air and the fluid interface. See, in case of alveoli, this is the alveoli and this is the blood vessels. Alveoli is filled with air and blood vessel is filled with the blood, that is considered to be the fluid. And alveolar inner wall, it is covered by the alveolar epithelial cells, and here you have the capillary endothelial cells. So always there is a surface tension between the air and the fluid interface. What is meant by that surface tension? What role it is doing over here? Surface tension. It will always have the attracting force. So this surface tension will always have the attracting force and making the alveoli to collapse. So all the alveoli, if you see in the respiratory bronchioles, all are in the sac-like structure like the bunch of grapes. You will have all the alveoli sticky together. If one alveoli is getting collapsed, automatically all the adjacent alveoli will collapse. This is called as surface tension. And this surfactant, it is reducing the surface tension. How it is reducing the surface tension is the alveoli, inner walls of the alveoli, it is covered by the surfactant. This surfactant is produced by type 2 pneumocytes of the alveolar epithelium. And this surfactant synthesis begins only at the 28th week of the gestation. If the baby is born after 28th week, it may be of either 29th week, 30th week, it will undergo normal breathing. It can able to withstand because there is presence of surfactant at the 28th week itself, but not to the required level, but there is presence of surfactant. But in case of this case, only 27 weeks. So there is total absence of surfactant. So what happens? The surfactant deficiency will not increase the surface tension. Sorry, it will not decrease the surface tension and the alveolar collapse will take place. So that is the main function of this surfactant. So the one more factor which you will add along with the residual volume intrathoracic pressure is the surfactant to prevent the collapse of the lungs. So since the surfactant is covering the inner walls of the alveoli and it prevents the affinity between the air and the fluid interface. So it reduces the surface tension. Okay, clear? And now moving on to the respiratory gases. It is going to move from high pressure to the low pressure area. So now consider the alveoli and the blood vessels. So this is the venous blood. This is the arterial blood. Venous blood is bringing blood from the level of cells. Okay. So now see the value of oxygen and carbon dioxide in the venous blood. Oxygen is only 40. The partial pressure of oxygen is only 40. The partial pressure of carbon dioxide is 46. And now see the partial pressure of oxygen at the level of alveoli. It is 100. Okay. So now when this venous blood go and reach the level of alveoli, what is the partial pressure difference between the oxygen in the venous blood and the alveolus? 60 mm Hg. This makes the oxygen to move easily from the alveoli into the blood capillary. Once when it gets the oxygen, then what is the partial pressure of carbon dioxide in the venous blood? 46. In case of alveoli, it is 40. So there is a difference of 6 mm Hg pressure in the carbon dioxide partial pressure, which kicks out the carbon dioxide into the alveoli, which is expired. Okay. Once when this exchange is done, then now it becomes the arterial blood. So arterial blood, now the partial pressure of oxygen is 100 and the partial pressure of carbon dioxide is 40, which is going to enter the level of the cells. Okay, so this is the concept of external respiration. And now from the blood to the level of cells, again you are going to get the same pressure difference, which makes the cells to do the exchange process with the oxygen and the carbon dioxide. So this pressure difference of partial pressure difference between the oxygen and carbon dioxide makes the gas exchange to take place.